Welcome to the virtual McMaster Museum of Art. We are pleased that you have chosen to join us for the Immune Nations webinar series. So the exhibition was developed prior to the pandemic. It's co-led by Natalie Lovelace with Steven Hoffman and Sean Caulfield. The exhibition explores complex issues related to the use and distribution of vaccines in the world today and the capacity of artistic research to solicit complex forms of effective engagement when dealing with difficult and divisive social and political topics, such as vaccination. Immune Nations was first offered to the McMaster Museum of Art several years ago when a project contingent came to Hamilton to visit the facility and consider the context. Plans were made to relaunch the exhibition, which had previously been exhibited in Geneva and Trondheim, in Canada and Hamilton and at the museum in the fall of 2020. But the pandemic was well underway by then, and so the exhibition's presentation was rescheduled to the present. There have been additions for your information to the exhibition content as a result of the COVID-19 pandemic. There are 3 panels in our webinar series, the one today, which I'll get back to in a second, but also on November 25th, a panel entitled Research Creation and Global Crisis, which is a panel investigating the role of research creation in tackling pressing social and global problems. Panel 3 on December 9th, entitled Vaccine Confidence, Fear, and Misinformation in an Age of COVID, which is a panel exploring the impact of misinformation on vaccination, as well as ways of countering the negative impacts of misinformation in relation to public health. For your information, all of the panels will be under the same format. They will occur at the same time. They will just be on different dates. And all of the panels have been supported significantly by a grant from the Natural Sciences and Engineering Research Council of Canada. In terms of housekeeping, for today's panel and the subsequent ones, we will have a 45-minute roundtable, then a 30-minute open chat or Q&A, and then a 15-minute closing provided today by Steven Hoffman. Please load your questions into the Q&A feature at the bottom of the screen. You can load them throughout the event, and they will be directed to Steven either individually or grouped thematically, and he will then bring them to the panel for response. So I'd like to welcome our visitors. I'd like to welcome Steven, the Director of Global Strategy Lab, and I'll hand it over to him now to introduce the panelists and start our panel.
Great, Carol, first a big thank you to you for your leadership at the McMaster Museum of Art and for enabling this opportunity to present the exhibition in Canada, but now given the pandemic also enabling it to be presented virtually around the world. So a big thank you to you and your team for making all this possible. So my name is Steven Hoffman. I'm a professor of global health, law, and political science at York University, where I direct the Global Strategy Lab, which is a research program focused on how countries and other public health entities can work together to address various kinds of health challenges. I'm also very fortunate to have had the opportunity to co-lead the Immune Nations project with Natalie Lovelace, Associate Professor of Contemporary Art History and Theory at the University of Alberta, who also served as this exhibition's curator, as well as with Sean Caulfield, Centennial Professor of Art and Design, also at the University of Alberta. And with that, we're really excited to be presenting this panel. As Carol mentioned, it's the first of a 3-part series. And today we have such an amazing group of people who are spending or lending their time in order to ensure we can have a really good conversation. We're going to start off the first sort of 40 minutes, maybe a bit longer. We're just going to have a conversation among the 5 of us, get things going. But I would encourage everybody who is in attendance, please do think of questions that you'd like to pose to the panel, whether it's to someone in particular or more generally. And you can definitely use the Q&A box in order to do that. And we'll make sure to leave lots of time to address those. So with that, let me introduce our panel, which is great. So first, let me introduce Annemarie Hou. Annemarie is the Executive Director of the UN Office for Partnerships and the former Chief of Staff and Director of Communications at UNAIDS. She collaborated with artist Patrick Mann to develop the Immunations exhibition's dissemination station. Next, let me introduce Alison Humphrey. Alison is a PhD candidate and a Vanier Scholar in the Department of Cinema and Media Arts at York University's School of the Arts, Media, Performance and Design. And she's the leader and the artist behind Shadowpox, which is also part of the Immunations exhibition. Next, let me introduce Lauren Paremoer. Lauren is a senior lecturer in political studies at the University of Cape Town, and she's a leading thinker on health activism, global governance for health, and political mobilization. And last but not least, let me introduce John-Arne Røttingen, who is Norway's ambassador for global health, which he's now serving following previous roles. He served as the founding interim CEO of CEPI, which is the Coalition for Epidemic Preparedness Innovation, as well as the former CEO of the Research Council of Norway. And actually, John-Arne is currently involved in so many aspects related to today's discussion, serving as a board member of Gavi, a member of COVAX's Shareholder Council, among other efforts. So we have an amazing group of people here coming together. I'm really looking forward to this discussion. Just a big thanks in advance, though, to all of you for being here and the panelists for taking the time. Let me frame the discussion by just sort of acknowledging that Immunations as an art exhibition was very much focused on the life-saving potential of vaccines. This was out of recognition that vaccines are one of the most incredible scientific and social advances that humans have ever been able to cause. And in that respect, the numbers are just make the case self-evident. Every year, vaccines save 4 to 5 million lives. That's every year, 4 to 5 million people don't die because they had the benefits of vaccines. And just from an economic perspective, every $1 invested in vaccines actually produces at least $16 of direct benefit. What that means is that vaccines are not just cost effective, they're cost saving. And in fact, if you get a 1 to 16 return on your investment, there's no better investments, I think, that we can make. There aren't that many better investments. Certainly that's better than the stock market. So unless you know of a stock market that I don't know about, but a 1 to 16 ratio is just incredible. That being said, there's challenges, and that's what Immunations Art Exhibition is all about. So the first is that 1.5 million children still die every year from vaccine preventable diseases. That highlights that we have invented technologies that could save an additional 1.5 million kids every year, but we haven't been able to fully make use of that technology. We haven't been able to fully deploy it. And that's for so many reasons. There's lots of challenges. Some are related to market failures, others related to clinical trials, others related to manufacturing capacity, the cold chain, figuring out how do we fund procurements of vaccines most effectively. But then there's also, in the context of COVID, so many other questions come up, things like vaccine mandates, addressing challenges like vaccine hesitancy, as well as, of course, misinformation that's been too pervasive during this pandemic. With that, then let me hone in on sort of the first of sort of 3 parts of a discussion I'm hoping to have with the panel today before we go to the Q&A. And for this, Annemarie, I'm first going to turn to you. This is really about the role that art can play in thinking about scaling up the life-saving potential of vaccines. That's what Immunations was all about. And in your former role, when you were the chief of staff at UNAIDS in Geneva, you were actually the host of the exhibition. And for those who can see my virtual background behind me, this is actually UNAIDS. This is part of the Immunations exhibition that was displayed there. Annemarie, tell us, why were you excited about the idea of hosting Immunations at UNAIDS? What did that sort of mean for you and for your agency that you previously worked with?
So I think when we started these conversations back in 2015, I'd like to say that we had the foresighting on our side about the even greater importance that vaccines would play in our lives. Of course, we didn't have that. I think you gave a very good explanation of why they were so important, what intrigued us about it. But what we did already know was the powerful combination of art, advocacy, science, and policy. And we talked a lot about that through the AIDS response, where I come from, where artists like Keith Haring and others really spurred an advocacy movement, where art and AIDS became an expression of not only of loss and remembrance, but ultimately of inspiration and action. And you can think a lot about the way that art gives voice and transcends language and being able to draw people in to spark some of these very difficult conversations, to get out messages around prevention, and also to demand action, say, for treatment. I think there's a lot that in that movement where media had started to pick up on this, and it gave it a lot more prominence. Obviously, art has been connected to all of these things throughout history, but just pushing at each evolution has been really interesting to see. And so in that kind of a background, it was great to take what we had learned through the AIDS response in art and bring even more to it around vaccines, and to be able to host it at UNAIDS during the World Health Assembly. So this is a time when health ministers from around the world, heads of state, all come together to talk about these important issues. And it was a great way to introduce potentially policymakers and political leaders to this new paradigm of, art on the one hand, the messaging, the policy part, and the science, how it all comes together. And it was such a wonderful mix. And I think a lot of very interesting conversations were sparked. But out of that, there was quite a lot of discussion about how to bring these different areas and sectors together going forward. And I was really excited to see that happen and to be part of it. And it was in that the lobby of UNAIDS is about the size of a football pitch. And if you just think about, and it's about 4 stories tall, so you can just think about these big structures filling the space and people interacting, and really, for the first time, I think, thinking about, for many, was thinking about how it all comes together in their lives. And that was very special.
Thanks so much, Annemarie. And I guess then fast forwarding then a few years to today, I know that you now as the executive director of the UN Office for Partnerships, that you've been sort of taking that spirit with you to your new role now in New York, where you've been doing amazing work trying to mobilize the world's artists to be able to contribute to the COVID-19 response. Tell us about those efforts. Tell us about how this all links up in the current context of the pandemic.
So taking you back to the beginning of the COVID-19 response, we were getting these very strong, smart public health messages from WHO and from others and from different countries. And these public health messages are very, they can be dry, and they can be sometimes a little bit hard to understand, and they might not grab people's attention. And so we, the United Nations and this really talented team at the Strategy Hub, really said, okay, let's appeal to all the creatives out there. This is a moment where people want to come together. They want to do something. And so we asked them, how can you help us get the word out based on this very science-based, research-based information? How can we get the word out on hand washing, physical distancing, knowing there's symptoms? How do we myth bust? How do we continue to spread kindness? And how do we really promote and amplify solidarity? And artists responded. It was amazing. We have nearly every country in the world with multiple languages from all kinds of platforms, from Twitter to TikTok. And that's the power of communication and how things change and being able to take advantage of all this. In all, there were something like 16,000 submissions that really helped young people and older people get the message. They were beautiful, funny, poignant messages that also helped us stay connected and keep us safe in those very first days, and continue to really spread that message of solidarity. And it was exciting to see just how many people wanted to be part of that movement, because they could reach others in different ways that maybe the first line of that public message could not go that much further.
Yeah. And Annemarie, you give me the perfect segue to now speak to Alison, bring you into the conversation, because Alison, you were actually one of those 16,000 people who submitted to the open brief that had been led within the UN system, by Annemarie, yourself, and others in the Strategy Hub. Alison, so you evolved actually the Shadowpox, which is the contribution from yourself that's in the Immunations art exhibition. In that you brought it basically online, created a stay-at-home edition, right? And I'd love to hear from you. Tell us about that submission. Tell us about the broader Shadowpox project, including, of course, the edition that's currently up at the McMaster Museum of Art. Over to you, Alison.
Thanks so much. Yes, and I have to add that Steven was part of a larger team that actually worked on the Shadowpox game that was part of Immunations. I'm just going to share my screen and share a couple of images because art works best when you can see it. So here is sort of a few images of a couple of different incarnations of the game. In the top left, you can see the Shadowpox #Stay Home edition, which was the one that we developed in response to the UN open brief. And I was very, very keen for us to participate in what was kind of a flowering across the world of artists trying to help the public visualize concepts like, the asymptomatic spread. So this game was helping you think about your little character. If you decide to leave your little house, you don't know that you're infected, but you're walking around your neighborhood and there are 99 other neighbors in your area. And as you walk, you're dropping virus particles. If any of them cross it, they have a 50% chance of getting infected. And after that, a 20% chance of requiring hospital care. In the top right, you then see one of the kind of Poximon cards that we had for each one of the people that you infected, so that you could actually really think about these people, not just as statistics, but as individuals just like you with, hopes, dreams, loves, families, friends, and the impact of your personal choice to go out or to not to physically distance, and how that impacted people around you. The game in the exhibition itself is more of a choice not to physically distance, but whether or not to get vaccinated. And so in the bottom left, you see a screenshot from that. And in the bottom right, you can see a player in the installation playing the game. And that little link at the bottom gives you a link to the website with more images. The game is part of a larger Shadowpox project, which is a story world, specifically a superhero science fiction story world, in which young people on 3 continents, in Canada, the UK, and South Africa, created characters who were volunteers in the first ever vaccine trial against this fictional virus, Shadowpox. And they were dealing not just with misinformation that their character themselves was trying to decide whether they were going to take the vaccine, but then once they did decide to take it and kind of became part of the embodiment of the vaccine, they were the target of misinformation and disinformation. So they're really kind of helping them think about fear and misinformation from a very personal perspective. And these are the 3 of the groups that took part. There's the Royal Academy of Dramatic Art in London, Dubaj Storytellers in Wicklow in Northern Ontario, and the Desmond Tutu HIV Foundation Youth Center in Masiphumelele, south of Cape Town in South Africa.
Also, it's so powerful showing the images of it and seeing it. So thanks so much for having that ready on hand to do that. If I can just ask a quick follow-up question, it's around the global resonance of the kind of message and the storytelling structure that you were developing as part of this art exhibition, the Immunations art exhibition, and as well as of course your doctoral work. And so, because you actually did your field work that was, and this was participatory, citizen engaged storytelling. These were stories coming from people in either Northern Ontario, in the UK, in South Africa. And one thing I think that's really interesting is that how common or how and clearly connected are different stories from all over the world. If you can speak to that, to the global resonance of shadowpox and those key themes, that would be, I think that'd be really interesting.
Yeah, so like I mentioned, it's a superhero science fiction story, and I like to call this sort of citizen science fiction. So it's like citizen science, but it's participatory storytelling in this slightly removed from reality genre that allows you to deal with some very, very hot topics, kind of with oven mitts on, right? So if you put something into a science fiction context, it kind of gives people a chance to sort of, you know, reach their hands into the fire. And so we were playing a little bit on the Captain America sort of trope of choosing to step up and test this new serum to gain powers, in this case, the power of immunity, for the good of your community. So in the first Captain America movie, you sort of see Steve Rogers make that decision, and that's part of his heroism. We also were playing with the resonance of the X-Men sort of story world, in which people who are heroes and who are doing good work are nonetheless framed as villains. And so the idea of vaccines through misinformation, through disinformation, being framed as villainous, as poisonous, as, you know, some kind of vast global conspiracy, it's a great science fiction story, but it makes for very bad reality. So basically, the participants were all kind of engaging in that and creating their own characters in a story world of those kinds of concepts and dealing with those ethics.
No, it's amazing. And certainly when you're describing around X-Men heroes being portrayed as villains right now, as this webinar is happening, there's we're seeing an effort around the world, people protesting outside of hospitals. And just today or yesterday, there was a news item in Nature journal talking about the number of increasing death threats that scientists have been receiving, especially those involved in developing vaccines for COVID. And so it's a science fiction turned into scientists' reality right now, but it highlights that these challenges you were addressing and that the exhibition is addressing certainly complex and in need of further unpacking and resolution, which is the perfect then for me segue. And I'd love to now talk about one of the biggest challenges of not just the now, but maybe of our time in this, and would going to bring in Lauren and John-Arne for this, and that's really talking about the challenge of vaccine inequity. This is really thinking about the current reality that almost 60% of people in high-income countries are fully vaccinated. It's 72.5% of Canadians, for those joining us from Canada, where the exhibition is currently being mounted. But at the same time, 96% of people in low-income countries have yet to receive a single shot. So that kind of gap, what that means essentially is that we have a limited pool of the number of vaccines that have been able to be manufactured, despite efforts to scale manufacturing. And the richest countries in the world have essentially made use of or taken 75% of that common pool, leaving only 25% of the pool left for a much larger number of people who live in low and middle income countries. And so this is certainly, we're seeing this in the newspapers and on TV every day. There's statements, so Dr. Tedros, who's the head of the World Health Organization, recently said, quote, "Vaccine inequity is the world's biggest obstacle to ending this pandemic and recovering from COVID-19. He continued by saying, quote, "Economically, epidemiologically, and morally, it is in all countries' best interest to use the latest available data to make life-saving vaccines available to all." Indeed, more recently, last month, the International Monetary Fund, the IMF, released a statement which included the statement that, quote, "This crisis of vaccine inequity is driving a dangerous divergence in COVID-19 survival rates and in the global economy." And then maybe most impactful, at least for me, when I read it, it hit me. It was when our UN Secretary General, Antonio Guterres, back in February, initially calling and speaking to the UN Security Council, said, quote, "The rollout of COVID-19 vaccines is generating hope, but at this critical moment, vaccine equity is the biggest moral test before the global community." And then fast forwarding last week, the UN Secretary General sort of doubled down by saying, quote, "Not to have equitable distribution of vaccines is not only a question of being immoral, it is a question of being stupid." That was from the world's top diplomats, very direct. Certainly he has been a leader in this fight for greater access to vaccines. And so, Lauren, maybe I can turn it first to you. I've painted a bit of it's an ugly picture. And it's, I think certainly everyone on this panel would agree with that. Could you tell me about, like, how do you see this picture from your perspective? In particular, when I see it, I think how the inequity is, of course, costing. We can measure it in terms of lives lost. We can measure it in terms of opportunity lost. But there, of course, are some people benefiting. I'm in Canada. People in Canada and other rich countries have actually sort of benefit from inequality and such. So I'd love to hear from your perspective, Lauren. How do you see this ugly picture from where you sit?
Thanks, Steven, and thanks for inviting me to be part of the panel. Maybe to start with the last quote you mentioned, which framed this inequity as immoral and stupid, I think it's also important to note that it's intentional, right? So Edward Said, in reflecting on writing Orientalism, says that, he thought a lot about how you tell a story. And he says, a starting point is really important, right? And so one starting point we could use for this story is that we're all human. And the systems that we create are the products of human ingenuity and creativity, right? And so the system of trade, the system of international law governing trade in essential commodities, even the system that commodifies essential goods and services like medicines, these are all products of human creativity. And if that's the case, presumably we could change it. If we're not changing these systems, then we have to reflect on whether or not that's an intentional decision that we're making, right? And so, of course, different people are differently positioned in terms of that intentionality. So I think, for me, the answer to the question of is it intentional would be yes. And I say that partly because the TRIPS waiver is being discussed at the moment at the World Trade Organization. There is an opportunity to be emphatic about the fact that we're in the midst of the worst public health crisis, I would say, in our lifetimes. The TRIPS waiver is one way to be concrete in terms of our solidarity, to share intellectual property, so that vaccines, but also therapeutics and diagnostics can be manufactured in many different places across the world, thereby expanding supply. Because we are looking at a constrained supply of, in this case, we're speaking about vaccines. And that's meant that less than 4% of people on the African continent, where I'm based, have been vaccinated. And it's disturbing when you read newspapers based in the global north, and the COVID-19 epidemic is spoken about in the past tense. So there is this huge schism where in some places the epidemic is being framed as over. And there's a sense of life returning to normalcy. I will also say that, if we think broadly about the injustice of vaccine inequity, I would say it's not only unjust because a significant proportion of the world's population is being left. Michel Foucault talks about this concept of letting die. So we've created these systems that are kind of neglecting people to the point where they're letting die. I would say vaccine apartheid is one example of that. But I think it's also particularly unjust because in many ways, the continent of Africa, for example, has been central to trying to establish a system that is opposed to that. So during the HIV/AIDS struggle, the African bloc was particularly influential in advocating for the Doha Declaration, which was supposed to specify emphatically that during public health emergencies, international law should be interpreted in a manner that protects the right to health, that protects the right to share in the benefits of scientific progress, and that the right to intellectual property is not absolute in the face of these other rights. Africans, including South Africans and many others in the global South, have participated in vaccine trials, and yet we're struggling to access the very same vaccines that we put our bodies on the line for. I think also, one of the things to think about is, and really this comes back to the phrase vaccine apartheid, and to kind of circle back to my first point, that this inequality is the effect of a legal system. So we know apartheid, of course, in South Africa was a legalized system of racial discrimination. And because it was legalized, it was, there were attempts to try and frame it as just, to conflate law with justice. And of course, it's obvious to us looking back that that conflation not only obscures the lie that law is not always just, but it also kind of, I think, obscures the moral urgency of the matter. I think if we're clear about the fact that the TRIPS framework as it's being implemented is legal, but definitely not just in terms of its impacts. And that's in terms of access to vaccines, but also the infrastructure to produce essential medical products in the global South. Then there is a huge disjunction, I think, in this case, between law and justice. And that's something we can change and have to change.
Lauren, thanks so much. And you mentioned TRIPS waiver, you mentioned the Doha Declaration. I think people will be really interested to hear more about that. So I will come back to you shortly, but because to ask you to explain more about that. But first, before we go there, John-Arne, I'd love to turn it to you. I know that you have been at the center of some really important international efforts to try to fix and address these challenge of our time, this vaccine inequity that we currently see. I know you've been working around the clock at all hours, and thank you for that. Can you give a sense, what does the global landscape look like in terms of the kind of efforts that are currently being done to address this problem? And from your perspective, what's working, what could be improved?
Yeah, no, thank you. And I definitely share the concerns about the situation we are in currently, and that we're not in the place we should be. We can definitely frame it as inequity, but we can also frame it as scarcity, because the underlying situation is that we do not have enough vaccines for the total population. So it's scarcity is driving the inequity. In other situations, you have other drivers than actually scarcity. And I think it's also important to understand some of the sort of driving forces behind that, because the global vaccine market normally produces maybe around 4 billion, of course, vaccines a year. Now we have produced 3 times as much just in COVID-19 vaccines. So in a way, it demonstrates that the world is not set up to actually produce the number of vaccines that you need in a crisis, because no one has been willing to pay for that with the redundancy in many ways. And there are many challenging around it, and I would be happy to comment on some of what Lauren said, but maybe first on what we have tried to do, at least as a sort of global community. When early on in 2020, as we know, there was no vaccines. So we can also say, of course, that even the existence of now many different effective vaccines is a big success. Even though we have failed in delivering them, it's a success of science. It's also a success of sort of a global system. Early on, that was, of course, not necessarily the outcome we be expected. So, because normally it can take 8 years to develop a vaccine, actually from you start till you get it on market. So there was a huge effort collectively to both develop and also prepare for making sure that we could have equitable access for vaccines early. So organizations like CEPI that you mentioned, they were the first to actually invest in COVID-19 vaccine development already in late January and early February in 2020. And then CEPI together with Gavi formed the COVAX collaboration that gradually expanded to be the COVAX pillar, where the World Health Organization, Gavi, and the Global Vaccine Alliance and CEPI have worked together. And again, that then became a part of an umbrella partnership that is called the Access to COVID-19 Tools Accelerator that started in April 2020 with the aim really to provide not only vaccines, but also diagnostics or tests and treatments, even though at that time we had very limited treatments for of course, specific treatments for COVID-19. But we know that even basic treatments like oxygen have been a scarcity in many settings. So that collaboration have been sort of semi-successful in the sense that it has raised $18 billion to actually mobilize financing for both vaccines and these other technologies, and has provided help to many nations. Today, I think COVAX is the main the main responsible organization for delivery of vaccines to 57 countries. Ideally, we would have wanted that to be much higher. And the big challenge has been that COVAX has been put last in line in many ways on the available vaccines. But that's also it's a situation that you could say it's sort of intentional, but it's also legal in the sense that I think, as we know, governments are primarily responsible to the citizens that are within their country borders. That's a basic sort of assumption of human rights. And governments have definitely prioritized their own population. We can discuss now whether that has been over-prioritized, and I think there are definitely signals that it's not only unfair, but it's also stupid to actually prioritize the way we have done, in particular in the later phase, because we need to control the pandemic. We cannot rely on controlling the epidemic in each individual country. But we must also understand that every country have made that decision. So the first and primary reason for lack of reduced numbers of vaccines available through COVAX is the need that, or the decision made by the Indian government to stop export from March, April, or actually April, I guess, 2021, which of course was very understandable, and which it was very similar to decisions made by European countries as well as the United States and others with vaccine production capabilities. And the reason was, of course, the large surge in cases in India. Then we have production problems, which was the other main factor. Many of the vaccines were not being delivered in the speed that they had planned, because it's complex and difficult to produce biological products like vaccines, and they really didn't deliver on their plans. And then I think actually COVAX was the first sort of buyer to be hit, so other countries were prioritized. And then finally, some of the vaccines that Gavi or the COVAX facility bought, they are still not approved. So they have taken longer time to develop, and we are waiting for regulatory approval of those vaccines. So there are many factors leading to the situation we have today.
John-Arne, before I go back to Lauren, I just want to ask a follow-up. I'm going to start to integrate questions that we're getting in from those attending the webinar, which is really about how do we resolve the issue of manufacturing capacity. You mentioned that one of these challenges here is that there is a scarcity of COVID-19 vaccines. There are efforts to scale up manufacturing capacity, but it's a challenge. And you mentioned the example of India deciding, because of the domestic need within India for COVID-19 vaccines, to then not export, which severely affected the COVAX facility. What's the solution to that? Because of course, vaccines have to be manufactured somewhere for the next pandemic and such. And wherever they're manufactured, there could be export controls and such imposed. Any thoughts on how do we break through this manufacturing capacity challenge?
So one is, of course, the short-term solution, and then it's the long-term solution. So on the short term, I think we need to just use all the facilities, the infrastructures that are available, and vaccine plants are not easily available, and we need to use the ones that are there and use them at their maximum. And to do so, you need technology transfer. You need to transfer the know-how and the capacity to produce the vaccines. That was what was done early on when it comes to the expanding Indian manufacturing. So it was technology transfer of the AstraZeneca vaccine as well as the Novavax vaccine to the Serum Institute of India. And there have been other technology transfers of the more sort of old types of vaccines, so the inactivated vaccines, both from China to other countries, as well as sort of de novo vaccine production based on that technology in some countries with the old traditional way of producing viral vaccines. The long-term solution, though, is to really, I think we have seen now, it's to build up sufficient capacities in all regions, because I think we due to what I said about the primary responsibility of governments to protect their own citizens, I think in a crisis, I think the only solution is to have regional and local manufacturing capabilities. But that doesn't mean that every country on the earth should have vaccine production capabilities, because that would be very expensive and probably not of sufficient quality either. So we need to collaborate. So this difficult balance of good collaboration, relying on partnerships and each other, but at the same time not relying on a few sort of large-scale global supply chains. I think we actually need to diversify in all regions.
Yeah. Lauren, I promised to come back to you. A lot of people are reading about TRIPS waiver, Doha Declaration, intellectual property related to vaccines. I know that today the TRIPS Council is meeting. One of the items under discussion is, of course, around COVID-19 and scaling up access. Can you help demystify what is this TRIPS waiver? What is TRIPS? What is TRIPS waiver? What are we actually talking about here? And from your perspective, why do you see this as part of the solution for addressing the immediate needs?
So maybe to start with the Doha Declaration, which is an international agreement issued in 2001 in Doha, that was aimed at clarifying that the trade-related aspects of intellectual property rights framework, which for short is referred to as TRIPS, that came into effect in 1995, was supposed to both protect intellectual property, but not in a manner that impeded or undermined the right to health, right? And so the Doha Declaration effectively states that, yes, under international trade law, there is a right that inventors of new products have to patent their products, to benefit from being able to decide exclusively who should be able to replicate those products, at what price those products should be sold, but that there is a kind of limit to that right, particularly when it comes to medical products. And that limit is that patents should never be used in a manner that, especially during a public health crisis, undermines the right to health, right? So that's I guess the short version. It is also worth mentioning that TRIPS is a legal framework, an international legal framework that all World Trade Organization members endorse. Like I said, it came into effect in 1995, and it standardizes by and large the kinds of commitments that countries make in terms of protecting intellectual property rights. before TRIPS came into effect, there wasn't this global baseline standard. Countries had more latitude in deciding to what extent they would protect intellectual property rights. And certainly prior to 1995, it wasn't standard to, for example, give patents on medical products or processes resulting in the manufacturing of medical products, or to give a standard length of time during which these patents would be protected. So in other words, there was variation. But TRIPS by and large does away with this variation. So
maybe a
that's
quick, maybe a quick question, Lauren, though, is so if TRIPS is most, so it's trade related aspects of intellectual property agreement. So we're really talking about probably it's really patents here, right? So there's those who invented the, in this case, it's mostly patents, those who invented COVID-19 vaccine, patent for it and have the right to sell it at the price that they choose and such. But if hearing from what John-Arne was talking about earlier about how manufacturing capacity is one of the biggest limits, how would waiving of the patents or such, or having compulsory licenses that countries could do to compulsory authorize the use of knowledge from that patent on a compulsory basis, how would that help if there isn't manufacturing capacity to be accessed?
Okay. So actually it's more than patents, it's also copyright, industrial design, know-how. So you might have a knowledge in terms of the patent about, you know, what goes into a product, but you need someone to explain to you how to bring those things together to make the end. So the TRIPS waiver, in terms of those 4 broad categories of intellectual property, it speaks to patents, industrial design, know-how, copyright. It also applies not only to vaccines, but also diagnostics and therapeutics. So it's broader than just vaccines, it's broader than just patents. Why is it necessary? So South Africa and India on the 20th of October last year proposed this TRIPS waiver, and they said that it's necessary because voluntary licensing, in other words, where a company says to another company, we need your assistance in producing additional stock of a particular vaccine. So for example, AstraZeneca made the Serum Institute of India a sub-licensee. Voluntary licensing has not been common. It's in fact been very limited. And so that's one of the restrictions on expanding the supply of vaccines. Voluntary technology sharing has not been effective at all. So there's this mechanism called CETA, the COVID Technology Access Pool. It's based on the medicines patent pool. No company has voluntarily shared their intellectual property through CETA since it was established. Yes, you could do compulsory licensing, but it's bureaucratically and legally intensive. It takes a long time, and in fact you have to do it on a case-by-case basis, and a lot of the intellectual property that applies to COVID-19 technologies, it exists in these thickets, so it's not just one company that you have to take out a compulsory license. Again, it's a whole kind of buffet of companies, if you want to put it that way. So compulsory licensing would not, and even if you could do compulsory licensing, countries sometimes face political retaliation for trying to resort to compulsory licensing. So the idea is that a temporary suspension for at least 3 years of COVID-related technology, intellectual property applying to COVID-19 technologies would free up the ability of countries to share knowledge, of countries and pharmaceutical companies to share knowledge. It's not something that will automatically result in a huge increase in technology transfer. There are a range of other factors that are needed, but it is, at least in terms of the legal framework, it does create a legal baseline where countries know that they won't face retaliation, either political, economic, in terms of trade sanctions, or legal retaliation for sharing technology, information on how to produce vaccines and so forth. And in the case of mRNA vaccines, the MSF Access campaign, for example, argues that it could be done between 6 and 9 months. On the African continent, there are potentially about 9 manufacturing firms that could assist with this. And this would result in, as John-Arne said, in regional manufacturing hubs that could, for example, supply the African region.
Yeah. Thanks, Lauren. I'd love to, Annemarie, I'm shortly going to come to you because I'd love to talk about, get us to start talking about recovery and sort of the path forward. But John-Arne, maybe if you might be very well positioned to help speak to some of the complexities in this, because as Lauren just mentioned, it was a year ago that India and South Africa put forward this idea. But it's also the idea that this TRIPS waiver as proposed is something that's never been done before, as far as I'm aware, and such. So it'd be quite it's probably it's certainly complex or might be perceived as such by various actors involved. John-Arne, any from your perspective, I asked partially, I'm putting you in the hot seat because Norway is currently the chair of the TRIPS Council. So it's not you, it's your counterpart, it's another ambassador in the Foreign Service. But can I put you in the hot seat just to sort of explain about what are the challenges of the South African-India proposal and what's the way forward?
I think the challenge is of course, this balance of providing incentives for innovations, at the same time making sure that you have access for everyone. And the main problem is that the choice we have made as through legal systems, as Lauren said, for making incentives is exclusivity. And of course, exclusivity is counter to access. That's in a way that, and it's a trade-off between them. I would have hoped, though, that there have been much more active attempts to actually use the flexibilities that are already in the TRIPS framework. I know they are complex, including compulsory licensing, but there has, to my knowledge, not been any attempts for actually using compulsory licenses, and that could have been used. And so that's one mechanism. The other is that for many countries, the IP will not be enacted. So in a way, for least developed countries and many countries, companies will never challenge the use of that intellectual property. And that has not been utilized either. And the main reason for this is, of course, that we are not talking about simple products. These are not simple chemical products. They are quite complex products to produce. Now what we have done, and we have worked on this for quite some time, it's through the COVAX task force and also the Accelerator Facilitation Council, we established a working group on expanding vaccine manufacturing. Some of that has been linked to other trade barriers on the input factors, but one of the work streams, and to me the most important one, is to establish new local production capabilities. And there is now underway an mRNA hub in South Africa that will be the first hub on mRNA vaccines that will also transfer technology to other South African countries. And so far, I think the choice has been made because indeed none of the big companies, or not big, some of them are actually small. Moderna, for instance, is a small company only having one vaccine. They have not been willing to sub-license the vaccines to the hub. They are those. So we should say that, acknowledge that Pfizer will have decided to build up mRNA vaccine production in South Africa, and Moderna has announced to establish a $500 million production facility in Africa for their mRNA vaccine. But still, the mRNA hub has decided to move ahead using the same technology that Moderna is using, and relying on the fact that as I said, that IP will not be challenged. And hopefully on the way, we will also see that they will probably accept it. So I think moving forward by actually concrete action is important. And I would say that would have hoped that in a way India and South Africa could have started some of that action early on. And if I am frank, I think the challenge is that some of this it's a much broader issue. It's about trade policy, it's about the system as such, which of course also have its faults. And I think the COVID-19 case and the waiver has been used as a symbolic tool for the problems of the trade and intellectual property system as such. I think on the long term, I think we need to improve the safeguards in that system. I think we have demonstrated now that the safeguards that were decided by or agreed by the Doha Declarations, they are not sufficient, and that we need to prepare for future crises to actually have better safeguards in the system. But we need exclusivities. That's the problem. Without the exclusivities, there is no clear incentives for private sector to actually do the innovation.
Annemarie, I'd love to turn it to you to begin a discussion among the panel about where we go from here and the role that vaccines will play, not just, of course, in the immediate response in terms of ending this pandemic, but also vaccines more broadly about promoting a better recovery, a more equitable, more sustainable, more resilient recovery. As well, of course, the Sustainable Development Goals, which your office, the Office for Partnerships, the UN, very much organized around building partnerships to support achievement of those goals. One of the amazing things about it is it provides that unifying framework that makes them equally applicable to all countries. So how do vaccines help us get that better recovery? How do vaccines help us go towards achieving the Sustainable Development Goals?
I like what you said, Stephen, that the Sustainable Development Goals are for all countries. And I think for maybe there was a bit of a perception that, oh, these don't apply to us. But I think COVID really showed us just that there are so many disparities, rich country, poor country, in every community that we're seeing these disparities. And it goes beyond, when we went into lockdown, that means a lot of students stopped going to school. And then when families were able to get vaccinated and things, social distancing, all these things started coming into place, or when they weren't able to do it, they were able to go to school digitally, get on an online schooling. And then you started to see disparities again, and then a whole new digital divide of students who could not get on, who did not have access to online. So you see how it just sort of kind of snowballs. And I think what's the greatest promise of the SDGs, the Sustainable Development Goals, are these 17 goals that really look at all aspects of our lives and how do we improve them. And if we'd been a little bit further along, we would have built up that resilience to be able to kind of shock-proof, if you will, or crisis-proof a bit more around anything that might come our way. And that's the hope right now, is as we come out of recovery in countries and as we continue to get vaccines to people, is to look at ways of how do you can see them very clearly. What are the gaps now? Where are they? How can we start to close them? The other thing is that we have this completely shared experience right now, a shared lived experience. I mean, everyone on this earth has experienced COVID in some sort of way, and that's powerful. What do we do with that shared lived experience? How do we propel that forward to go beyond? I mean, we've heard a lot the word moral, like the moral purpose, the moral reason. I mean, how do we just make it happen? And we don't really need whatever the reasons that may bring us to that shared lived experience of how do we get that to, so that we can get that for everyone. That shared experience of the COVID is also the shared response of what happens when everyone can have access to vaccines. Then maybe finally, it's just to say that every crisis is also within a number of other crises. So things haven't stopped between climate change and conflict in the world. You just layer these on, and we are seeing in some parts of the world where they're dealing with not only COVID, but now a huge food shortages because of economic downturns and families not being able to, their one safety net is gone. And so now they're going to lose all the other nets that are there to catch people and lift people back. So how do we continue to look at all of this and not in isolation, but as a whole? And sometimes it's easy to do, and I think we absolutely need to do these surges, but we also need to remember that you can't surge ahead in one area without falling potentially back on others. You have to lift everyone on all of these issues, with an eye to lifting them together.
Thanks so much, Annemarie. And I think it gives me a perfect opportunity to both turn to Alison, but also integrate a question that we did get from the audience, which is around the role that art can play in transforming the world into a better place. I think about previously when Lauren and John-Arne were letting us know about the global structures, international intellectual property law, and all the complexities and nuances there. But also now with Annemarie highlighting that vaccines as a shared experience, and from that perspective, and actually Annemarie really highlighting we need to do it. Like we need to figure out how to mobilize the kind of change that we need for that better world at the end of this. Alison, what role can art play in all this? And I say that this Immunations exhibition was about looking at these issues, was about motivating change. Tell us more about that.
Well, just speak to my own art form, which is storytelling, whether kind of theater or recorded drama. And something that I learned when I was working with the Anishinaabe theater group at the Bajamajig Storytellers is that there's sort of a tradition of teaching stories. So the use of stories to help us learn about things that we need to learn to live well, to live in a good way. And so, a story that is kind of shared across the world, for better or worse, right now is the story of Spider-Man. And his origin story has a pivotal moment in which he chooses not to stop a criminal who's committed a robbery and is getting away, because he says it's not my business. And moments later, that same criminal kills Peter Parker's Uncle Ben. And suddenly it is his business. And so that is the moment at which he learns that with great power comes great responsibility. And so I think that as a kind of teaching story for kids, but also for grown-ups who kind of grew up with that narrative, is for us to think about, what is our business? Who is my neighbor? What responsibility do I have with the power that I have? And I think, one of the really cool things I was able to talk with the young people in South Africa was the movie Black Panther, because it had just recently come out, and I was very curious to hear their perspective on an American tale set in a fictional African country. And there again, the sort of teaching, one of the core ideas in that is that the hero is the leader of a country. He is the maker of policy, and he is very protectionist. They have this fantastic technology in Wakanda of vibranium, and they want to use it to protect themselves. And he's afraid of what will happen if they go beyond that. And his opponent, who has many qualities, good and bad, makes the argument that they have a responsibility beyond their borders, and that they have this great power, this great resource, and they need to use it to help other people, other nations, especially disadvantaged people around the world. And it takes the entire movie for our hero to come around to deciding that, yes, that is in fact what he wants to do with his position, with his power, and in kind of collective action with his nation.
I find that really powerful, Alison. Using like story, who knew that going to see Hollywood movies would get at the core of these really difficult global collective action problems. But when framed in that way, I think it's actually really powerful. It then gives a perfect segue to another question from the audience, which was really around how do we get people and governments and policymakers to be thinking more globally? So it took, I guess, in the movie you're just describing, it took the character an hour and a half to get there over the course of the movie. But of course, it's really difficult, right? Because as John-Arne mentioned earlier in this discussion, many of these concepts are actually baked in that political leaders have primary responsibility to those within their geographic jurisdiction and under which there's sovereignty. And so, yet actually, when you look at a pandemic or something like COVID-19, it's clear that actually it's a self-defeating construct, right? So because according to the UN Secretary General, it's not only immoral, it's stupid, it's self-defeating because it actually will make this pandemic go on longer. How do we get people to think, and more challenging, how do we get people to act globally? Maybe Lauren, if I can turn to you, give a first word, and then if anyone else wants to chime in on that, please do so. Lauren.
Well, you know, I think one way to get politicians to act differently is to vote them out of office or to threaten them with that. So, you know, if you're a Canadian citizen, you can advocate for your government to be more emphatic in its support for something like the TRIPS waiver. To support, I always get the pronunciation wrong, but Biolis, is that how you say it? In manufacturing COVID vaccines, to act as a sub-licensee for COVID-19 vaccines. Similarly, you know, if you're a citizen of the UK or Switzerland or Germany. So, you know, there's this anthropologist, James Ferguson, that wrote this famous book about development. And he says the development machine is an anti-politics machine. It kind of creates this idea that development is about technical interventions and bureaucratic exercises, and it's something that's to be done over there in the so-called global south or the third world. And in a short article that he does on the book, he reflects on someone asking him, well, you know, if development is such a failed enterprise, what should I as an American do? And Ferguson says, well, we engage in domestic politics. That's if you change things at home, you actually have a concrete way to change the world. So it might seem glib, but I'm not being glib. I do think that's one kind of intervention. So that's with regards to the TRIPS waiver. But also, you know, I think we need to complexify this idea that governments look after their own citizens first, because I do think we also need to take into account that the domestic playing field is not even. So there are citizens that live at the margins of society. And then there's Big Pharma, which is a huge industry that invests a lot of money in lobbying governments to support policy positions that would protect the profitability of their enterprises. And so, you know, yes, government may protect those kinds of citizens to a disproportionate extent in terms of the policies that they implement domestically, but also in terms of global policies. So I think, you know, this is something, if we take the HIV example again, that ACT UP recognized in the US. So ACT UP actually said, well, it's a fallacy to say that this government protects its citizens, because actually the queer community, the HIV positive community at that stage, excuse me, Haitians were associated with HIV/AIDS immigrant communities are being neglected. And they're being neglected in favor of a different group of citizens, for example, huge pharmaceutical companies. And that's unfair. So I do think also domestically, these kinds of actions have an impact in terms of populations dying because of drugs not being developed that could benefit them, or the drugs being too expensive. And in the case of Canada, for example, you have a public health system. These drugs cost the public purse a lot of money, partly because of the monopolistic structure of Big Pharma. So I think, you know, even if you start advocating at the domestic level, there are ways in which you could restructure these bigger legal and bureaucratic frameworks to have a global impact.
Great, thanks, Lauren. And before I will invite other panelists to chime in on that same topic, if they'd like to do so. I did want to tell the audience, though, if there we have 15 minutes left. So if you do have a question, feel free to use the Q&A button at the bottom of your screens to ask them, and we'll integrate and try to answer as much as we can. But to the panel, I think building on what Lauren said, how can we get countries to think global? I don't know, John-Arne, if you're the one to keep on putting in the hot seat and the spots, but you've been a leading thinker, for example, on how to globalize some of these approaches. A lot of your previous work has been around that there's many issues that transcend national boundaries. They're more efficiently solved when countries can come together to address them. Any any nuggets of gold or like lessons around what we need to get countries to sort of think and act globally?
Yeah, maybe first to start on a positive note, and then a more difficult one later. But we should acknowledge that we are on track to actually vaccinate 70% of the world's population in the next 12 months. I think that's a realistic target, and we would not have been able to do that without very clear collective action. So this is a result of collective action. COVAX is on track to deliver 1.4 billion doses by the end of the year, and then substantial more than in 2022, as I said. So in a way, we have also demonstrated and used the ability of collective action. I think the challenge, though, is that if we need to rely on partnership and collaboration between private sector and public sector. And I have worked on trying to establish innovation models for needs that there are really little or even almost no purchasing power. So in particular, the diseases of poverty, diseases in countries with less ability to pay for those technologies. And the only way then when there is not a commercial market is, of course, that the public sector in some, so across countries, actually collaborate. The challenge is it's been very hard to establish agreements on that and actually establish commitments to fund technology development at the level needed. So to me, it speaks to the challenge for politicians to actually make very high risk investments. And because, as you know, most of innovations fail. And in a way, we have allowed the private sector fully to take on that risk. But then, of course, paying the price of exclusivity as the main mechanism. My thinking of the way forward is really to build on that division of labor, but build in much more stronger commitments and conditionality when the public takes a role to incentivize additional to what we normally do for diseases where there is not a sufficient market. I think we failed to do that in the COVID crisis. CEPI had conditions on access, but they were only a small funder. The big funding that came into the field of COVID-19 vaccines were the early advanced procurements at risk from governments. So in a way, they did at-risk investments without conditions. So in a way, governments took a lot of the risk, but they didn't really put in conditions on global access and accessibility. And I think we have learned from that, and we need to institutionalize systems like that for the future. And I think we are on the way to actually do that by the discussions we have started on reforming the system for the future. So I'm hopeful, both for the current pandemic, but also for a future system of health preparedness that can improve.
Yeah, thanks, John-Arne. We have to remain hopeful during these times, especially in light of issues, but also hope that hope can mobilize action to address them, which is, I think, so important. Annemarie, I guess I'd love to, building on John-Arne sort of gave there a prescription for the future. Would love to hear from your perspective, how do we go from here? I mean, Immunations, again, as an art exhibition, was really all about unpacking these problems, pointing towards solutions. We've seen the UN really step up, I think, during this pandemic in so many different ways. I get, from your perspective, moving forward, how do we promote better recovery? How do we promote better resilience? What's the role of the UN in all of that going towards the future? Annemarie.
Thanks, Stephen. And the UN has continued to deliver, and from UNICEF creating hubs and WHO of getting vaccines to people and PPEs to people and food to people, from the World Food Program to humanitarian, again, working through all the different layers in the ways that they know best. And what gives me hope is this idea that, again, borrowing from the AIDS response, was around civil society and the people who are affected, nothing about us without us. And so using that lived experience, using people's, to help build that trust that is needed as vaccines are able to get to people. How do we get them to people the fastest? The First Lady of Namibia, who happened to help us open immunizations at UNAIDS, she was telling me during this last General Assembly that in Namibia, they really relied on different kinds of informal marketplaces to reach families, and really learning the lessons of what are the best small, tiny incentives that will actually bring people to, one, learn about vaccines, learn about COVID, learn about how to protect families, to get their questions answered. But how do you actually just get them there? Because if you think about these very abstract numbers of, reaching 70% in the next 12 months, it means something like 100 million people need to be vaccinated a month in Africa alone, something like that. That's a lot of people, and it can be done. And because we are listening and we are working with communities, we are partnering and we are building trust.
Annemarie, if I can also get you to reflect a little bit about the role that misinformation has played in all this. So in the Immunations exhibition, this was something that it's discussed quite a bit. It's a challenge we knew about. And I mean, it's in movies like the movie Contagion that misinformation played a big role there. But I think that's something we've seen is that the UN, whether it's WHO creating a new department around tackling infodemics, or whether it's UNICEF and other entities that are really trying to kind of correct or do myth busting efforts, working with scientists and public health authorities around the world. Tell us about how do we get through this, right? We're in this new world where it's so easy for people to just shoot off a tweet or post a message on Facebook with totally wrong information. And yet it takes so much energy and effort to counter it. So that asymmetry in effort in terms of disinformation and information means, like, are we fighting? Is this a war we're doomed to lose in terms of that information landscape? And the reason I ask you, Annemarie, the UN in this pandemic has really been trying to step up and do its part in doing that, and would love to hear more about that, Annemarie.
Just from our experience, the UN Secretariat through the Department of Global Communications has started this program called Verified. And the premise is really simple. It's just, if you see these 2 yellow check marks and there information coming to you about COVID, that's been verified. It's been tested. It's been looked at. It's been checked, and you can trust it. Because again, at the end of the day, it is building trust. And I do think it is absolutely worth whatever effort it does take to counter misinformation, because it can be so damaging and so hard to undo. And I think there's a lot of interesting research in science to help understand people, the psychology of making decisions around these kinds of things, and what kind of information do people need to be able to make a choice for them about getting vaccinated? What is not dissuading them from becoming vaccinated? There's been some amazing work with a number of different around how all of this information comes together. And so I'm really excited that, one of the things we did was they worked with researchers who worked on the vaccines and taught them about TikTok and taught them about these different kinds of platforms that they probably weren't really aware of. And they became TikTok stars about talking about what they're doing in the lab. And this is my lab, this is what we're doing. And my little part is part of this big part. And this is what my colleague is doing over here. And helping people connect it. It goes back to Alison's point about storytelling. It's getting people information in ways that they can absorb into their own lives and relate to. And scientists are, people may have a misperception about what a scientist does. And here they are really opening up and talking about why they're doing what they're doing and why they think it's interesting for you to know, and how can they potentially help you make a good decision for you and your family. So I think all of this is absolutely worth it, because at the end of the day, if we can continue to saturate with good information, with science-based information that is good for the world.
Thanks so much, Annemarie. And that's, I guess we were able to draw on not only your current role, but your communications background and such. And really, it's been amazing to watch how a system has been able to mobilize anew for this new threat in ways that weren't as present in previous pandemics that have been faced. So it's really it's been impressive to watch. Lauren, I want to give you the second last word, and because in a lot of your comments and frankly, a lot of the discussion we've been having today is highlighting that our world is a fundamentally very unfair place. And our world has structures that on one hand have enabled enormous success. And we do need to emphasize that development of this vaccine, for example, for COVID, development of any vaccine, development of future vaccine, and the full range of technologies and other things are huge human achievements. But at the same time, those structures don't work for everybody. I guess thinking about the future, what can we draw from COVID, from this pandemic experience, about the kind of changes that we need in global governance to get to a better world? What's the top of your list of probably many changes that you'd want to see, Lauren?
Well, I don't know what's top of my list, but I mean, so I think I disagree with you slightly. And it's not that inventing the vaccine is insignificant. I think it's a huge achievement, but a vaccine in a vial does nothing. A vaccine needs to be in someone's body to be effective, to achieve the outcome that it's intended to achieve. And I am despondent about the possibility of that happening, sitting where I do. You know, there have been days during the big waves where you hear of a death, two deaths every single day, and these are deaths where people cannot go visit the person who is sick. They leave the house if they're lucky. They get into a hospital ward, and you never see them again. If you're lucky, you have data and you can watch the funeral on your phone or on your computer if you're lucky. If you're tired of doing that, you go to the funeral physically because you're tired of not being with your loved ones and mourning the dead properly. So it's great that there are vaccines. I think it's we're fantasizing if we think that the vaccines will be efficacious unless we all have access to them. You know, I think that's what it means to say no one is safe until everyone is safe. And I hear the point about we need exclusivities for innovation, but again, I'm not convinced. And I think the COVID pandemic is a good illustration of why I'm not convinced. And it's because a lot of public money went into developing the vaccines. So I think the US government, for example, invested almost $8 billion in developing the Moderna vaccine. And so it's not the case that pharmaceutical companies take on all the risk. In fact, they're heavily subsidized, right? And so those risks, the risks that they would otherwise carry, are subsidized by the public through taxpayers' money. And yet the benefits of the vaccines that they invent are not widely shared. And you know, so again, Moderna would be a good example that the US actually legally also is a part owner of that technology. And so it could share it. So I am despondent, and I think I'm despondent because the HIV/AIDS epidemic was supposed to put an end to this conversation. That was supposed to be the moment where we said, okay, it's clear when there is a public health crisis, there shouldn't be profiteering in the context of a pandemic. In fact, medicines derive their meaning from their ability to produce health. Yeah. And I think we're in an unjust and bizarre situation where, unfortunately, medicines, I think now derive their meaning from boosting shareholder value. I think that's the situation we're in. And I think that's one of the main structural drivers of vaccine inequity. And that's unacceptable.
Well, no, Lauren, that's certainly, I think it's really important. It's powerful, and I think we agree more than we disagree. So in terms of, but I think that's really important, the way you framed it, and really important way to actually wrap up this conversation. Alison, I was going to turn to you for the final word, but because we have run out of time, I will apologize for that. But did just very much want to thank everyone, for the panelists in particular, for joining today. You know, the challenges that we face with vaccines are, this is tough. I mean, these are complex issues that are really require sort of multiple disciplinary perspectives. It requires everyone to be involved. It requires citizens to be standing up and demanding action and demanding more of everyone who's involved in this whole effort. And I think then as a result, exhibitions like Immunations is really an attempt to engage people, all people, in these conversations. In this case, it's the latest edition being mounted at the McMaster Museum of Art, but through virtual forms like this, trying to reaching out to the rest of the world. So just a big, big thank you to the panelists, Annemarie, Alison, Lauren, John-Arne, for taking your time today to be with us in this conversation. What I will maybe just conclude, because we are out of time, is just letting everyone know that there are 2 later webinars that are part of this 3-part series. The second one is titled Research Creation and Global Crisis. That one's moderated by Natalie Lovelace on Thursday, November 25th, 2021 at 12 to 1:30 p.m. Eastern Time. And that conversation will be a dialogue with Ted Hewitt, Chara Kaushik, Caitlin Fisher, Patrick Mann, and Kim Tallbear. And then the third and final webinar as part of this series that's linked to the Immunations Art Exhibition is titled Vaccine Confidence, Fear, and Misinformation in an Age of COVID-19. That's moderated by Sean Caulfield on Thursday, December 9th, 2021 from 12 to 1:30 p.m. Eastern Time. And that conversation is with Tim Caulfield, Rachelle, Viader, Knowles, David Price, and Teresa Tam. Thank you again, everyone, for joining us. Really look forward to continuing this conversation at a future time. And if you haven't checked out the Immunations exhibition at Hamilton, please do. And if you're not available to go in person, check it out online. All the best. Thank you. Be well.